Good evening. My name is Ben Lanka. I'm the editor of the Newark Advocate. Thanks for joining us on this town hall to discuss the COVID-19 vaccine. While we all wore masks to protect ourselves, we will be taking them off for this program to make sure you can understand our questions and answers about this important topic. I'd first like to thank the Midland Theater for allowing us to use their venue to host this event, and the Licking County Health Department for partnering with us to answer questions about the vaccine. Also, I'd like to thank all the members of the public who submitted numerous questions about the topic, and I've tried to combine many of the questions so we can answer as many as possible. With me today to answer your COVID-19 questions are Chad Brown, Licking County Health Commissioner, Carrie Kennedy, Director of Community and Personal Health, Licking County Health Department, Olivia Biggs, Public Information Officer, Licking County Health Department, and Sean Grady, Director of the Licking County Emergency Management Agency. Chad, before we get started on the questions, if you could give us a quick update on how COVID-19 is acting in the community right now.
Sure. Thanks, Ben. And again, thank you to the Advocate for partnering with us, and for EMA for all their support, and for the Midland as well for allowing us to use this tremendous venue. So just a real quick update on where we're at as far as COVID here in Licking County. We did report 98 cases today, which is down from where we've been seeing things over the past few weeks. So we're hoping that trend will continue, but we can't promise that it will. We are reporting 24 hospitalizations as well. We have been seeing steady cases, just over 100 to 130. We did see a little bit of a peak last week, but we're starting to see, we did see some increase after the holiday there, but we're continuing forward with our effort with contact tracing. Can't say enough about the staff and how they're working and doing their best and working 7 days a week to contact folks to get them into quarantine, into isolation as well. But overall, we're seeing steady numbers of the disease. We're working hard to get the vaccine out so that we can stop the spread of the disease, and we'll continue to work hard with our partners and to vaccinate as many people as we can. Overall, though, we're working very hard, like I said, and we're seeing those numbers steady, and we'll continue to work with our partners and get those things done, taken care of. Other than that, that's all we got.
And have you seen any cases or any news about the new strains being reported about the coronavirus locally, or is it too early to say?
So yeah, I would say, Ben, it's too early to say at this point. Ohio State reported that they found a new strain of the virus today. We are hearing about a new strain that was in Europe, in England, and over in Spain as well. It's really too early to say if it's here in Ohio yet or not. Ohio State was reporting one case of that variant today. If there's one, there's likely more, but we still need to get more information.
Okay. Well, let's just dive into the questions submitted by the public. We had numerous questions about general concerns on how people will get the vaccine, how they will know when they're eligible, and how they'll sign up to get it. I was hoping you could kind of address that generally before we get into some specifics.
Sure, and that's consistent with what we're seeing at the office as well. We're getting numerous calls about folks and how they're going to get the vaccine. The one thing I can say is we're not going to keep it a secret. We're going to make it as public as possible, and people are going to know when the vaccine's available. We are getting ready to start a COVID hotline that will be ready to go on Friday morning at 9 o'clock. We'll announce that number on Friday morning so folks can call. They can call that number to ask questions about the vaccine. They can call that number also to schedule an appointment to receive the vaccine at one of our clinics. We are going to take calls from 9 to 3, Monday through Friday. When we have vaccine and we're scheduling a clinic, folks can call in, schedule an appointment, but we're only going to take the appointments for the number of vaccines that we have on hand at that time. Next week, we'll have a clinic on Thursday. Folks that are 80 years old and older, they can call on Friday to get that, to schedule an appointment, again, from 9 to 3, and we'll announce the number on Friday morning when we have everything live and ready to go. We won't keep it a secret. We're going to push it out. We'll have that number out in the public, through the Advocate. We're going to push out information through our social media pages, through our web pages, through all of our partners as well. We are partnering with the aging program to reach the senior population as well, in case they have trouble accessing things electronically. But overall, the best thing to do is call that number when we announce it. We'll get an appointment scheduled. If you get an appointment scheduled, you'll get a vaccine. We can't guarantee you're going to get an appointment scheduled when you call because we have a limited amount of doses of vaccine.
Will it be a call-in only? There won't be an online sign-up or anything like that?
Correct. Yeah, right now it'll just be call-in only. We may, everything changes by the hour with COVID, so we may see that morph into an online system, but right now, yes, it'll be a call-in only.
Okay. So the governor released a schedule of eligibility based on age and other factors. Will the county be following that schedule?
Yes, so we're bound to follow that schedule. We'll be moving into phase 1B next week. If we don't follow that schedule, there's a possibility they won't give us any more vaccine, and that's definitely not something we're interested in. So next week will be for those folks that are 80 plus. The week after that, it'll go down to those folks that are 75 and older, down to 70, and then 65 and older the week of February 8th. On February 1st, school personnel become eligible to receive the vaccine as well. We've been working very hard with the schools throughout the county, the public and private schools as well. We've asked the school districts to poll their staff so that we know how many employees want the vaccine so that we can schedule those clinics. As of now, as of today, we were at about 1,800 school employees that wanted the vaccine, so we're looking forward to scheduling those clinics for them. But yeah, we are going to follow the governor's schedule, and we have to. We have a limited number of vaccines, and we're going to try to get it as many people as we can. But people just need to understand we have a limited number.
And so on that, I assume, will there be enough vaccines to go around when a certain group becomes eligible? For instance, next week, will every 80-year-old be able to get it who wants it?
So just so individuals know, with that tiered approach that the governor released that first week next week with the 80 years of age and older, the governor did say that in that age range, there are 420,000 Ohioans in that age range. However, there's only going to be 100,000 doses of vaccine allocated throughout the state of Ohio. So that kind of puts into perspective the short supply that we're dealing with. And it's important to know that when a new age group begins, the vaccinations may not be complete for that particular age group. However, it's just going to be a rolling system. So the short answer to that is no, we're not going to be able to get through every individual in Licking County who's 80 years old or older within that first week, but we will continue to work on that phase 1B as it rolls out.
But if you're 80, you could still get it the second week, third week, et cetera. That
Absolutely.
would still be fine.
Yep.
Okay. Have you seen any logistical issues that have slowed distribution of the vaccine? And do you expect the vaccination rate will speed up over time?
So we have seen the doses of vaccine coming into the state, and as the governor said, we have a scarce amount of vaccine here in the state. Why that is, I can't answer that question. That's above us. So all we can do is get the vaccine that they give us. We have been told that there are additional vaccines coming. The Trump administration announced that they were going to push out the doses they were holding as second doses and let them release for first doses. We're still awaiting guidance on that from the state. That was an announcement yesterday. So we're awaiting guidance on how that's going to go. There is a push at the federal level to get more vaccines out. And I can tell you, we're working with our partners at the state. They want to get as many vaccines out as possible, and so do we. Our motto at the office is we want to get it and give it. We want to get it in and get it out as quickly as we can to those folks that are eligible.
And do you guys have the staffing or partnerships available to distribute the vaccines that we would have?
We absolutely do. So we've done a lot of planning for this. We've been planning for a pandemic response such as this for over 10 years now. We've had plans in place. Can't say enough for EMA and how they've helped us with that. Sean's a wizard with logistics, and he's helped us out a ton with that. Also, we're partnering with Ohio State University Newark to do clinics there on site on campus. They've been a wonderful partner. Basically, anything we've asked for, they've given us, and it's been great. Our staff has been amazing, and we've been training for this. We have a plan for it, and we're ready to implement that plan. All we need now is the vaccine so we can get started.
And quickly back to the limited amount, how will you be allocating which people get a vaccine if not everyone in the quadrant or cohort will be able to get it?
We're going to release that information on Friday about the COVID vaccine hotline, and it'll be open from 9 to 3 every day, where we'll be taking the information for eligible individuals and getting them an appointment. So really, when it comes down to it, it'll be first available depending on the amount of vaccines we have available.
Okay, so basically first come, first serve for people in that specific quadrant.
Yes, to make the appointment for the clinic, yes.
Okay. A specific question about someone asked about his wife had both severe asthma and obesity and does not appear eligible currently under 1B. What will people with these kinds of underlying health conditions be moved up, or is it strictly age-based?
So right now in phase 1B, the state has laid out obviously the age-based approach, the teachers as well. There is, the folks with with underlying health conditions can qualify, but there are specific conditions that you have to qualify in phase 1B. As the governor said, there's only about 77,000 people in the state of Ohio that will qualify with those medical conditions in phase 1B. So you figure 77,000 people across the state out of 11 million. So there's not going to be that many in the county that are going to qualify. Just because.
Do you have a few examples of what those might be?
Sure. I know spina bifida is one of them. Type 1 diabetes is one of them. Carrie, do you know others as well?
Prader-Willi syndrome, Turner syndrome, congenital issues, and malformations would qualify as well.
So there are specific, I mean, it's a specific list of diseases that you have to have to qualify at that point. So just, not every health condition is going to qualify under phase 1B. We want to make sure people understand that as well.
Is there a place people could go to get the full list?
Absolutely. That's available on our website, www.linkingcohealth.org.
And will people have to prove that they have such a condition to be eligible to get the vaccine?
So that's a question that we actually asked to the state today, and we're awaiting a response on that. So as soon as we get that information, we will definitely push it out.
Okay. Elizabeth Swanson asked about her sister with a developmental disability and lives in a small group home in Newark. When will people in her situation be eligible for the vaccine, and how will they be distributed?
Certainly. Excuse me. The folks in the developmental disability facilities are in phase 1A. We have worked very closely with our local board of DD. They've been a great partner of ours, and over the years, and especially through this issue. We have scheduled a clinic for those folks on Monday, or I'm sorry, Monday is the holiday, so on Tuesday. That's going to be, they're in phase 1A. We'll take care of a third of those folks. We're going to try then to get them knocked out over the next 3 weeks with the vaccine that we receive. It's really going to be dependent upon the amount of vaccine that we receive and how quickly we can do them. But we are working with them. We do have a clinic scheduled for them, and we're hoping to get them done as quickly as we can.
Okay. Another reader asked that, said that they were diagnosed with the virus on December 5th. She was told that she can't get the vaccine for 90 days after her diagnosis. Is that correct? Or can they get the vaccine as soon as their phase is up?
So there are a couple of different things with that. If she received any type of antibody treatment or the plasma infusion while she was ill, she would have to wait the 90 days. If she did not have any of that and the illness just ran its course, she would need to complete her isolation period, which would be the 10 days.
Okay.
And after that, she would be eligible.
Another specific question, someone says that they were recently diagnosed with cancer and they were told that they can't have their surgery until they receive their vaccine. Does this play a role in how quickly they can get vaccinated, or is it still based on the state schedule?
Yeah, I think unfortunately that would still be based on the state schedule at that point. We would ask them to work with obviously with their healthcare provider to see exactly what they recommend. They can, with this specific instance, they could reach out to us. We would try to facilitate that to see if we can get them somewhere else where they can get the vaccine, maybe at the hospital where they're going to have the surgery, if they're offering the vaccine there. But in that specific instance, unfortunately, we're still going to have to follow, the phases that have been released.
Okay. And I know you touched on educators already, but how long do you expect getting teachers vaccinated will take in Licking County?
So that'll really depend on, one, how many want it, and two, how many doses we get to give them. Right now with 1,800 people in the school system, the schools across the county that want to be vaccinated, we realistically, if we had enough vaccine, we could do that in one day. But if we don't have if we have 200 doses to give them, then it's going to take a little bit of time to get it done. I know the governor has set a goal for having schools reopened by March 1st. The majority of our schools are already open, and they've been open since the beginning of school. They've done a super job at implementing those protocols. The short answer is it's going to depend on how quickly and how much we get a vaccine that we get.
So I don't know if you can say, on average, how much vaccine are you getting a week, just to put that in perspective?
So it varies.
Okay.
So the first week, I think we got 200 doses. We've received a total of 900 doses so far since the week of Christmas. So we would prefer just to get a shipment of about 10,000 doses so we could give it out as quickly as we can. It's coming out. It's scarce. We understand that. It's not just Licking County. It's that way across the state as well. But our goal is to end every week with 0 doses of vaccine so that we can get ready and go the next week as well.
Okay. Someone else asked about living out of state. So their home is in Newark, but they're currently Florida residents, so snowbirds. Are they able to return to Ohio to get their vaccines if they can't get it in Florida?
Yeah, sure. They're able to get it really anywhere because the vaccine is a federal asset. We just ask that everybody pay attention to which vaccine they get and pay attention to maybe when their second dose may be available and any pertinent information as far as logistics go.
Similar question, I assume same answer, but someone asks about, working in Columbus, living in Newark. I assume they'd be eligible to get the vaccine in either county
Yeah.
or in
that's
any
right.
county in Ohio, I assume.
Yeah. While we prefer to take care of our Licking County residents first, you can choose wherever you'd like.
Okay. You kind of touched on this already a little bit, Chad, but where will people need to go to get their COVID vaccine shots? And then how will they make those appointments? So if you just reiterate what you
Sure, yeah,
you
no
said.
problem. Like I said, we've partnered with Ohio State University here in Newark, and we're going to be doing, our first clinic next Thursday will be a drive-through clinic, and it will be right there on campus, and we'll have signage and volunteers out there to point people on where to go, and we'll be putting more information out as the clinic draws closer. The folks will be able to call that hotline number, and again, we'll be publishing that Friday morning, so that folks can call that, make an appointment, and get scheduled in to get their vaccine. We'll do the majority of our mass public clinics over there at Ohio State. We have a contract with them. We feel great about that partnership. People need to keep in mind that they shouldn't just show up at the health department on Tuesday. We don't have the vaccine to give them. So that's why we're scheduling appointments so that we can schedule enough appointments to get rid of the vaccine and then move forward for the next week. But if you show up at the health department on Tuesday expecting to get a vaccine, you're probably not going to get it because we don't have any to give to you.
And I assume people also shouldn't just show up at the clinics without an appointment, correct?
Exactly right, yes. Yeah, you have to have an appointment. We are going to verify folks as they show up, in the drive-through. We're going to verify that they are on the list and have been scheduled. And then if they're not, we're going to ask them to leave, and we've got a plan for where they can go if they do show up. But yeah, if you don't have an appointment, you're not going to get a vaccine.
Okay. How will the vaccine clinics in the future be announced?
I'll take that one. Yeah, we're going to continue to be transparent with the community and let them know how many doses we've been allotted by the state so that we can plan accordingly with our drive-through clinics. And we'll be, once that hotline is established and announced to the public on Friday morning, like we've said, that'll be rolling. So people can continue to call that if they're eligible in those categories to get the vaccine. So we will let them know what the clinic dates will be, not only through that avenue, but social media, partnering with you, Ben, at The Advocate, and our radio stations and our website and other local organizations to continue getting the word out. And while we may not be the only provider, we encourage you to check other avenues as well. Licking Memorial Hospital may have some information available about clinics and upcoming with some pharmacies as providers as well.
A couple of questions on the call center. Is this a Licking County specific call center or is it an Ohio center?
So we are setting up a Licking County specific call center. We partner with Sean over at the 911 center where we're going to be at. So Sean, if you want to talk a little bit about the call center itself. Or?
Yeah, we're actually using the old 911 center, which is our current 911 backup. So we're using all of that technology to be able to handle that. So we'll have there'll be a health department representative, an EMA representative, and then a number of volunteers coming from our Community Emergency Response Team, or CERT, manning those stations. So,
is there any concern of call overload? I mean, obviously, we saw what happened over this summer with the unemployment system across the state. I don't know how that's going to be handled.
Well, that particular phone system is designed to take a large number of calls. And I'll give you an example. When we handled the floods in the new center on March 20th, our call volume went through the roof. We took over 1,000 calls just in that day alone, about a 12-hour period. So our system's built up that way, and the system at the old center is actually a mirror image of the system at the new center, so it'll handle the volume.
So a specific question for a user experience. If someone calls and there's not a person available, will they be on hold? Will it?
Well, right now we're matching the volunteers to the incoming phone lines. So the only time that would occur is if by some chance, because they are volunteers, we're short-staffed on any particular day, then that phone would ring until somebody picks it up. We don't anticipate the operators being on the phone for a long period of time. We're targeting about 90 seconds. So, but what I would tell the public is that if the phone rings and you're not getting an immediate pickup, call right back.
Okay.
And one thing to that, Ben, as well, we are trying to tell the volunteers to make it as quick as possible, schedule the appointment and move on, so they can answer as many calls as possible.
Right.
We are going to answer your questions, but at some point, they're probably going to say, I need to move on to the next person.
Okay.
And if they have an issue that is more than they can answer in that call center, they'll be referred to another source.
Okay, very good. A reader asked about his mother, who he said is an invalid and cannot go outside of the house to receive the vaccine. The health department went to her house to administer the flu shot. Can you do something similar to administer the COVID vaccine?
So we really don't have the capacity to go to house to provide COVID vaccine. We just don't have that capacity at this time. If she can get out to go to doctor's appointments, she can come through a drive-through clinic. We can do it that way. Or we can make arrangements somehow to try to do that if she comes to the office and do it in the parking lot, so she doesn't have to get in and out of the vehicle. Also, if she has a healthcare provider providing care to her in her home, possibly and hopefully that healthcare provider is registered to receive vaccine, and they could issue the vaccine to her as well.
You mentioned drive-through clinics. What kind of accommodations will you be making at the clinics for people who might have mobility issues?
So when they come up and they pull up in the vehicle, they won't have to get out. All they need to do is have their arm ready, and we can give them a shot that way. So no one will need to get out of the vehicle. Once they get in the vehicle, they'll pull up. We'll get their information. We'll give them the shot, and then they'll pull right on through. So they'll never get out of the vehicle in a drive-through clinic.
Will the first clinics be drive-through only at this
Yes.
point?
Yeah, the first clinics will be drive-through only. With the 80-plus population, we assume there's a lot of mobility issues with those folks. So we want them just to drive through. We'll give them the shot and have them drive right on through the exit and back home.
What should they need to bring to their vaccination appointment?
So they need to bring the consent form that we have. We'll have them available at the clinic. But if the more folks can download the consent form and fill it out before they come, the quicker it's going to go. They also, we're asking them to bring their health insurance information as well. We'll scan the card and move on. There is no charge whatsoever for the vaccine. If someone doesn't have insurance, there's no charge for the vaccine whatsoever. If they do have insurance, we're asking that they bring that information so that we can recoup some of our costs as well. But there is no charge for it. We are not asking for any money whatsoever. If someone asks you to pay for a vaccine, it's a scam. It's not us. So they need to bring that information, and that's it. So the key is that consent form. The quicker you can get it, we try to make it as easy as possible to fill out, but it does take time to complete it. It takes a couple minutes. You take a couple minutes and times that by 300 people, that's a lot of time. So the quicker you can get it done and have it done before you get there, the better off we're going to be.
Now, is that a form you have to wait till you have an appointment to fill out, or is it something you could do at any time just to be ready?
You can do it any time, but just because you have the form filled out doesn't mean you're going to get a shot.
Correct.
Yeah.
I'm just thinking if I was with my grandmother who was older, and maybe I could help her fill it out before she had an appointment or something.
Absolutely. We would encourage you to do so.
Okay.
And Ben, this is communication that we're working on through this hotline when these appointments are made. So we have a script made so that once they make the appointment, we inform them to dress in layers so that it's easier to access the shoulder area for the vaccine. The location of the clinic, to be prepared if there's traffic delays in the area, giving them information about what they need to bring and where to access this form, and even information that they have the option of waiting 15 minutes after their vaccine in a parking area to be observed just in case they need any help afterwards.
On that last point, we did have someone ask about what steps will be taken to monitor for any potential side effects from getting the vaccine at clinics.
Yeah, and that's what that piece at the end. So once the individuals get their vaccine, as far as doing the drive-through clinics, we have a parking area there at the outdoor clinic where they can park, and we'll alert them. We'll say, if you need our assistance, beep your horn, and we have staff members who will be watching for that. And after 15 minutes, according to the CDC, they should be fine to go ahead and go back home.
And EMS personnel will be aware of the drive-in clinic happening, so either EMS will be on site if that's what that local fire department has determined what's going to happen, or they'll be aware that this is happening and be available.
And if need be, we do have rescue drugs that we can give if they're having an anaphylactic reaction.
In the vaccines distributed currently in Licking County, have you had any reactions that needed any kind of urgent medical attention?
We have not.
That's great.
We've not had any adverse reactions reported to us whatsoever.
Okay. Is it possible for married couples to register to get the vaccine at the same time?
If they're the same age, they can. However, we need to stick to the governor's plan of the groups defined by age. So it's a tiered system to get the vaccine to the most vulnerable population, like we said, starting with that 80-plus group and then moving 5 years down each subsequent week.
So you can't skip the age, but can you call in and say, I would like to schedule 2 appointments, one for me and my spouse, and we're both in the appropriate cohort?
It would depend on if we had the vaccine available or not.
Correct, if there was availability.
If we had multiple clinics scheduled for multiple age ranges, yes. But if not, then we'll have to stick to the age range that we're in at that time.
I'm saying, apologize. So if me and my wife were 80, we could schedule to get the same
Absolutely,
time
yes.
in one call.
Yeah, absolutely.
Okay.
And that would still occur if we get into the second part of the phase where 75 is allowed. It's one person's 75, one person's 80. They'd both be able to still
Correct.
schedule as long as the vaccine was available.
Okay. Another question. My family physician is in Franklin County. I think you already answered this. Can a person sign up in both counties to receive the vaccine, or should they only be signing up in one?
So, we'd prefer them not to take 2 spots just because we're kind of limited in vaccine. But they can get it in any county if they would like. But, I understand the idea to register there and register here and register there to see what you can get in quickly. But if you do that, just realize you're taking someone else's spot in line as well.
What will you do for potential no-shows at clinics?
So, yeah, I mean, that's probably inevitable that we'll have someone not show up. We've seen that now in phase 1A as well, where folks haven't shown up. We are not going to waste any vaccine. So we have not wasted 1 dose yet, and we won't as we go forward. We have a list of folks in phase 1A that we can call. So if we have those vaccines left over at the end of a clinic, we'll call those folks, we'll get them vaccinated, and ultimately end the day with 0, so we won't waste any.
So you're not currently looking for people to sign up for that list, people who might not be in 1A or 1B for, I guess, the overage list, for lack of a better term?
No, not right now. We're not, just because we have enough people in phase 1A that we still need to vaccinate. We can call them and have them come in.
Okay. In the clinics, will they be open extended hours for people who might be able not to be able to be there for regular business times?
So yes, we're looking at that as well. The first clinic we're going to run is going to be in the afternoon, but we're looking at, as we get into, more, once it expands more, once we get into the school personnel as well, we're going to have to run those clinics in the evening, when school's over or when they're out of work. Problem is, it gets dark at 5 o'clock. So we have plans at OSU where we can do an indoor clinic as well. We've got a great plan for that. People can come in, register. We'll be in the ballroom there at the Reese Center to give the vaccinations. We have an observation area in the auditorium as well. And then when you walk out the exit, you walk right into the parking lot. So, but yeah, we are going to have to schedule clinics after regular business hours.
Okay. And how is Ohio and I guess Licking County planning to ensure the second dose can be scheduled smoothly? This person asked especially for seniors who might not be able to operate technology well.
So for seniors and as 80-plus group, we'll notify them when the second dose is there. And I'm going to have Carrie talk about when the second dose can come and how often and when you can get it after that. We can talk about that. But we'll notify them. They'll be able to schedule again the same way that they did for this clinic through that call center. They can call the number, schedule, and it should be as seamless as possible. You want to talk about the 21 days?
Sure. So for a person that's received the Pfizer vaccine, they would need to wait 21 days to get their second dose. For the Moderna vaccine, they need to wait 28 days to get their second dose.
Okay. And is the health department partnering with Licking Memorial Health or other organizations to help coordinate vaccine distribution?
Absolutely. LMH has been a great partner. Can't say enough for us partnering with them. Our main liaison there is Ben Broyles, and I'll give Ben a shout out. The Board of Health named him the 2020 Public Health Guardian Award winner as well for all of his work, and he's just been a tremendous partner. We are working with them. They are receiving vaccine as well, and they are going to be holding clinics. They're going to be announcing that information. I think they may have announced it earlier today. That information's out where a number you can call and get an appointment. They'll be serving folks that are 80 plus as well. Some pharmacies, chain pharmacies in the county are going to receive vaccine. Kroger pharmacies in the county will receive it. Giant Eagle will as well. You can go to their websites and look for that information and schedule an appointment there. Just because all the Kroger pharmacies have it and we have it and LMH has it and Giant Eagle has it doesn't mean there's more vaccine. It's just a limited amount spread amongst everybody else. So there are still a limited number of vaccines here available in the county. People need to continue to keep harping on that, but and so does the governor because it is. It's reality. But yes, getting back to LMH, they've been a great partner. Looking forward to partnering with them as we go forward and more vaccine becomes available and we can vaccinate more and more people.
And similar to the different county question, I assume you also don't want people signing up at different organizations within Licking County to receive the vaccine to make sure we're not taking spots away from other people.
Correct, yeah, because it's just, again, you're taking more spots. If we register and you don't show, then we got to scramble to find somebody after the clinic to give it to.
Which vaccine will be given in Licking County? Moderna, Pfizer, or both? And do you need to get the same vaccine for the booster shot as you get for the first one?
So right now, we've only received so far the Moderna vaccine. We did receive an email today telling us that we should be receiving some Pfizer vaccine next week. So we're ready for that. And to us, that just means we're going to get more doses. So I think that's great. The Pfizer vaccine has to be stored a little differently, but we saw that coming, so we planned for that, and we'll be ready to go to store it. If you receive the Moderna vaccine for your first shot, you have to receive the Moderna vaccine for the second. If you receive the Pfizer, you have to have Pfizer for the second one as well. As Carrie said, for Moderna, it's 28 days between shots. For Pfizer, it's 21 days. Now, with the limited amount of vaccine that we have, that doesn't mean on day 28, you're going to get the second shot. If we have it, we'll give it to you and we'll schedule you in. But there's probably going to be a time where we don't have the second dose. Just because you don't get it on day 28 doesn't mean you're not protected. If you get it on day 40, you're still going to be just as protected as if you got it on day 28. You're going to have protection as well from that first dose. Some reports for the Moderna vaccine say that you could have 90% protection after one shot. So that's great news. We'll get you the second shot, but it's really going to depend on what we have and how much we have to give it to you. So, just don't come back to the office on day 28 and say, here I am, ready for my second shot, if you haven't scheduled that appointment.
Is there a time that's too long to wait between the shots that we know of yet?
Not that we know of.
Great.
And Ben, in addition to this logistics, talking about first dose and second dose, we do still encourage the community to continue wearing their facial coverings, masks in public, continue doing the social distancing, just to reduce the risk of spread of COVID in the community while everyone is trying to get the vaccine and the first dose and the second dose while they're short supply.
Okay. What supporting information can the Department of Health provide the community and or employers to help influence individuals to receive the vaccines? This is someone asking, do you guys have anything that you could give to companies in Licking County to help encourage their employees to become vaccinated?
So I think we've been pushing that message out quite a bit here. We think everyone should receive the vaccine. The vaccine went through, people want to say, went through a rush process. It still went through a rigorous scientific process with research studies, and it met the FDA's definition at that point. We are encouraging everyone that when they're eligible to receive the vaccine to stop the spread of the virus. I know that there's a lot of questions. Well, can my employer require it? That's a question between you and your employer. But we are encouraging everyone to get the vaccine when you're eligible, and we are encouraging all employers to urge their staff to receive it as well to stop the spread of the virus.
Are you concerned about vaccine hesitancy in Licking County?
Sure. Yeah, we've seen that in the beginning. When we very first started, we saw with EMS, we were seeing maybe a 40% acceptance rate. But now, as we're 3 weeks into this and we're not seeing any adverse reactions, we're starting to see more and more people say, hey, well, maybe I should have got it. Hey, I'd like to get it now. I think, as things move on and as more and more people get the vaccine, millions of doses have been, administered in the country. And you hear about one or two or, a few people having a reaction. And when you read those stories, this doctor in Boston went into anaphylactic shock. Well, he would have went into anaphylactic shock if someone gave him a shellfish too. So, those individuals are all carrying EpiPens around because they have reactions to things. So that's why we ask those questions, and our nurses can then, verify with those folks if it's safe for them to get it before we give it to them. And if they do get it and they have a reaction, we're set up to prepare to take care of them. As Sean said, EMS will be there to take care of them as well. But we're encouraging everyone, to get the vaccine when they're eligible.
And Ben, I think this comes down to education in the community as well, which we will continue to do, outreach and campaigns to try to encourage vaccines throughout our community to reduce the spread of COVID.
And are there people who should not get vaccinated? I mean, are there any type of specific health conditions that would prevent you from getting it?
Really, the only individuals that falls to are those that have had severe reactions to vaccines in the past. We certainly encourage them to speak with their doctor, or if they have a severe allergic reaction to any of the components of the vaccine. The biggest one being polyethylene glycol. It's a common component of a lot of skin creams, shampoos, even some medications. So likely if you are allergic to that, you're going to know it because of exposure to other things. But really that's the only thing that would cause you to kind of hesitate on getting the vaccine.
And
Okay.
Carrie, I think we have a couple questions on our registration form that we have them check marked,
Yes.
so just so we can go over that. Do you want to talk about those?
So we ask about any previous reaction to vaccines. That's one of our questions. So if you do answer yes to that, it doesn't mean automatically that you're not going to be able to get the vaccine. We'll just ask you some more questions about that to kind of see what your experience was. But otherwise, if you've not had any severe reactions, you will be able to receive the vaccine.
Okay. And how long from getting the vaccine do people need to wait to have some immunity to the disease?
I think studies have shown so far about 2 weeks. Again, I think research is still looking at those things, but for the studies that have been done so far, about 2 weeks after the vaccine, 4 weeks for the Moderna, I believe, 2 weeks for the Pfizer vaccine, you will see some immunity from that. So it's not going to happen right away. Your body has to learn how to react to that and build immunity to it.
And do we know how long the immunity lasts?
I think that's still being researched as well.
Still looking at that.
I've read 1 to 2 years, but again, I think that's something time will tell.
Okay. I had a reader question about whether getting the vaccine affects one's ability to give blood.
So according to the Red Cross, you can still give blood. You don't have to wait a certain amount of time to be able to donate. And certainly that need doesn't go away for blood within the country. So yes, as long as you're getting the Pfizer or the Moderna vaccine, you are free to give blood anytime.
Okay. Are there specific opportunities for community members to help or volunteer with vaccine clinics? And if so, what skills would you need?
So sure, folks can volunteer. We always need help, so we would welcome that. Skills would range from, being a nurse and administering a shot to, telling people where to park and pointing in the right direction for where they should go to get to the clinic. So, if folks want to volunteer, we do have a vetting process for that and the training process as well. But if they want to volunteer, they can email us at the office at health@lickingcohealth.org. But skill ranges can, I can't give shots, but I'll still be working at the clinic as well. So I can point people in the right direction where to park.
Okay.
And one thing with that, if I can add, for nurses or any other medical professional that want to volunteer, they do need to have an active license within Ohio to be able to do so.
And what is the health department doing to get information out to people who might not have access to social media or standard news organizations?
Yeah, that's a great question, Ben. We know, especially with these most at-risk groups, the 80 and plus, that they may not be on our Facebook page. So we, along with partnering with our local media and doing social media, website, those type of outreach pieces, we're also partnering with our local agencies to share information. That'd be like the aging program, Meals on Wheels. We do communicate with our healthcare providers to let them know what we're up to so that if they do get a call or a question from an individual, they at least know where to refer that individual for more information from the health department. We do have a COVID defense team, which has been in place for a few months now. This was asked of us by the governor, which includes a lot of local leaders in Licking County. And Chad and I have a weekly call with our COVID defense team where we're very transparent in what we're working on, what's upcoming. We provide them links and resources. And so we hope that they share that information with their channels in the community as well. And in addition, like I said, we're really excited to launch this hotline in Licking County on Friday, so individuals can call in. But lastly, we're really hoping that family members of these individuals will keep them informed of what's going on with vaccines in Licking County.
Okay. And then my last reader question was they read an article released stating that leaders of Ohio's county health departments have been warned to expect a tsunami of COVID-19 cases in late February. Is this concerning at all?
So yeah, I know that statement was made by the medical director at ODH, on one of the governor's press conferences. I think he was referring to the different variant that we're seeing in Europe, and hoping that it doesn't make its way to the United States and specifically Ohio, but I think it's inevitable that it will. I think that could be an issue. We don't know. It's a new variant, so it's new, just like COVID. But I think we'll be looking for that. We have the surveillance network in place to take care of that. We look at things, data pretty much hourly at this point, throughout the day and 7 days a week. There's a possibility that we will, but there's also a possibility that we'll see, a wave of cases from a large event or anything else as well. So with a new variant, especially we have a new virus, then a new variant of that virus, it's hard to predict what's going to happen. But, having him say that definitely got us on alert, and we'll be looking for that, and we'll continue to watch the data.
And Olivia, I assume that gets back to your point that it's not time to take the virus lightly. I mean, we still need to be doing the things to stop the spread, even though the vaccine is here.
Yeah, absolutely. We're very grateful that we have vaccine options available in Licking County now. But again, it's a very limited supply right now. And as supply ramps up, we're still asking community members to keep their distance, continue to mask up, and reduce the spread of COVID in our community.
Great. Well, thank you all for your time tonight. And thank you to the readers for all the questions you gave us. Before we end, Chad or anyone else, if you'd like to make any final points or reiterate anything you think is critical, now is the time.
Sure. Yeah. Thanks, Ben. I appreciate it. Again, thanks to you and the advocate for working with us on this, and the Midland for letting us use this facility. But we just want to say, we're encouraging everyone to get the vaccine. The vaccine has been proven to be safe so far, and we want folks to get vaccinated. Vaccine right now is scarce for sure, and it's limited. We're going to give it out as quickly as we can. Just know that we're going to give it out and that it's limited. We are opening up this hotline on Friday. That'll be the main way, the only way to schedule for a vaccine appointment and also get your vaccine questions answered. But the main point is, we're going to get to you. We're not going to hide the vaccine. We're going to be as transparent as possible. We're going to let people know, when those clinics are scheduled, who's eligible to come to those clinics, and get your appointment scheduled as quickly as we can. It's all going to be dependent on the amount of vaccine that we receive and how quickly we receive it. Before we sign off here, I would be remiss if I didn't thank the Board of Health. They've been supportive, amazingly supportive since the pandemic began. Folks may not know, but I became health commissioner in June. So, right in the middle of a pandemic, this wasn't how I envisioned this going. But the board's been tremendously supportive of me and of the whole department, and can't ask for better support from them. And definitely want to thank the staff. I mean, we've got people working 7 days a week. They've been working 7 days a week since March, doing contact tracing, doing planning on things, and working on things constantly. I've not been around a more dedicated group than I have, over the past 6 months or past 9 months now of the pandemic. And, I can't say enough for their dedication to the people of this county, and they are doing their absolute best, to take care of people, to stop the spread, and to keep people healthy. And I just can't, I've never been prouder to be part of a group or part of a team and associated with these professionals. They are tremendous. And I want people to realize they're working every day as hard as they can to control the virus to keep them healthy.
And I'd feel remiss if I didn't at least ask this. There's been a lot of talk about the hotline. I assume we are not releasing the number currently, or is that not available yet?
That's correct, Ben. Yeah, it's not available yet. We're working on it. It will be ready Friday morning, and we'll make that known as well. Okay. We're not going to keep that a secret. We want people to call, so we'll be ready to roll with that. Great.
And we'll be sure to share that number as soon as we get it at the Advocate as well. Thanks again to all of you for your time, and thanks for watching. Appreciate your efforts. Let's do our best to beat this pandemic. Thanks a lot.